Hey everyone, welcome back to our weekly Intel Brief, where we do one really important economic issue, one really important security issue, and one really important democracy issue that happened in the past week. First, on economic issues in general, we're still in a shutdown. We are now 10 days into a federal government shutdown. Right now, the Senate is still in session. The House has been out for almost 20 days. And we are basically having the same conversation we had 10 days ago. Democrats and Republicans just need to get in a room together, negotiate like adults, and have a conversation on how we're going to reopen the government. Actually, the Michigan legislature just did this, right? Divided government, Democrats and Republicans locking themselves in a room, hashing out a compromise, and reopening the government there. So we can certainly do the same thing at the federal level. But if we're going to have that negotiation, it's important, certainly to me, that we start having a conversation about health care. The big, beautiful bill that the president signed into law back on July 4th has precipitated a health care crisis in the country. Every single person watching is either at risk of losing their insurance or paying more for their insurance. And so if we're going to have a conversation, I'm going to start on the issue of health care. Now, we asked a couple of days ago for Michiganders to start sending in their notices, their letters that they were getting in the mail on the increase in their health insurance, whether you were on the healthcare.gov marketplace or just have normal private employer-provided insurance. We got over 400 letters in just a couple of days, and I wanted to go through some of them because I think they're examples of why we're fighting hard to have the conversation about healthcare. We heard from a woman and her husband who own a small child care center in Ypsilanti, Michigan. She said that they just got notice that their healthcare plan that they provide for their small number of employees is going to go up by $469 per month. And her husband, the owners of this small business, are having to decide whether they're still going to provide health insurance to their employees. We have a man in northern Michigan. He's also got private employer-provided insurance, and they just got notice that the company-wide health insurance costs are going up next year, as of January 1st, by 19%, right? A man from Jackson actually called us up, and he said that he's a retiree, but he doesn't yet qualify for Medicare. A lot of those people are in trouble if you're between sort of 55 and 65. And he said that because of the changes to his marketplace plan, his health care is going to go up by $1,500 per month. He was paying $440 a month. That's what he pays now. And as of January, it's going to go up to $1,900 a month. So you can imagine the kind of conversations that are happening in his house about whether to continue having health insurance. Then we have a clergy member from mid-Michigan who wrote in to tell us that her employer-provided insurance for her and her husband is going to go up by $2,200 a year next year for the same exact coverage, no changes. A woman in Houghton in the UP says she's only able to afford health insurance now because of the tax credits she gets from the ACA marketplace, and she's now extremely worried that she is not going to be able to afford Assure insurance whatsoever and is waiting to hear what the increases are going to be ahead of open season on November 1st. Because of the big, beautiful bill and the changes, the significant changes that that's created in healthcare in general, a bunch of private insurers are just not offering the plans that people are currently on. So we have a bunch of people who are sending us their notices that the plan they are currently on, that their family depends on, is just not going to be offering health insurance at that level starting January 1. So they're having to switch and find a program that will inevitably be even more expensive. Then for people who get their insurance from healthcare.gov or for the marketplace, as we call it, people like entrepreneurs, we know that open season starts November 1st, and some of the plans that people are currently on are going to change and go up significantly. Right now, people are getting notices that they will have an increase. They don't know the exact numbers yet. There's a lot of waiting till the last minute, but a ton of people are about to get notice ahead of November 1st that their marketplace plan that they get from healthcare.gov is going to go up significantly. We're still collecting stories of how health insurance of all kinds is going up because of this crisis. You can post those stories, you can send us those stories at slotkin.senate.gov/letters. On security issues, I want to talk about these strikes that the president has authorized in the Caribbean against boats, vessels that are carrying drugs from drug cartels. There's been 4 strikes in the last couple of months, 21 people killed total. I've received classified and unclassified briefings about these strikes. The president sent notification to Congress in September that he was now in a non-international armed conflict against these terrorist groups, these cartels, and had labeled them terrorist groups. Again, in my former life as a CIA officer and a Pentagon official, I was involved in going after terrorist groups. And I don't have a problem going after a lot of these organizations given the drugs that they are carrying and what that does here in the United States. But what's really different about this issue is that the administration has refused to provide the list of these groups they are now calling terrorists. We understand that it could be dozens of groups that they have now listed terrorist groups. In all of our wars past and all of our conflicts past, we notify to Congress that we're going to go after Al-Qaeda or ISIS. We name those groups so that we know who the United States is in armed conflict with. And the administration now refuses to explain and list the organizations that we are now in conflict with. This is extremely different and unprecedented for how we go about war in our name, especially at some place as close as the Caribbean. Now, the reason this has major implications inside the United States is because the president put out also in September a new domestic terrorism executive order. And in that executive order, he made clear that there are a number of groups that he's going to be looking at. He's asked his Department of Justice to look at inside the United States that he believes could be domestic terrorists. He had a very broad definition of what a terrorist group is inside the United States. He talked about not having Christian values or having different views of the family, just a very, very broad definition. But my concern is that there is potentially, just as there's a secret list of groups that we're going against in the Caribbean, could there be a secret list of domestic terrorist organizations? And then what does that allow the U.S. government to do here in the United States on American soil? The president has already sent both law enforcement and uniformed military into places like LA, Portland, now Chicago. He stood in front of 800 generals and talked about their need to go after, quote, the enemy from within and to use American cities as training grounds. All of this raises the prospect that the president could call what's going on in one of these cities an insurrection and invoke the 1807 Insurrection Act, a very old act that's on the books. If the president does that, then that means that the uniformed military, active duty uniformed military, has the ability to act as law enforcement in American cities. That means they have the ability to conduct raids, to arrest, to detain, something that, again, is completely contrary to the values of the United States and goes right back to the founding of the United States when the British soldiers were abusing Americans here on our soil. So this is an issue that I'm watching very, very closely. Just this past weekend, there were leaked conversations that the Secretary of Defense was considering sending in the 82nd Airborne into places like Portland. The 82nd Airborne is not the National Guard. That is active duty military. That's a very powerful and storied Army unit. And this is not the first time that the President of the United States has considered sending in active duty troops to quell protesters. In his first administration, President Trump asked a former Secretary of Defense to send in the 82nd Airborne to Washington, D.C. to put down George Floyd protests, peaceful protests. And he asked his Secretary of Defense, according to that secretary, can't you just, quote, shoot them in the legs a little bit? So for me, this is an incredibly important moment on the use of force in America, on the use of the uniformed military in America, and on labeling groups that the president doesn't agree with as domestic terrorists. This has major implications for us as a democracy and for people who are exercising their freedom of speech, freedom of expression, freedom of assembly, and how we would use our military against citizens of the United States. So we're watching this issue very closely.